Hi, everybody. My name is Sebastian Mei. I am Chief Marketing and Development Officer at Milwaukee Film. It's an honor to be here speaking with everybody today. I want to thank Mary and Michelle and everybody at Rotary for giving us this opportunity, but also for supporting our organization and supporting the Minority Health Film Festival as well. There could not be a more important time to be having this conversation in our community. I am a second-year Rotarian, and this is also our second Minority Health Film Festival. And like I said, it's an incredibly important time to be having all of these discussions, but I'm going to stop yapping now and introduce the people who are going to be sharing the info about what this festival is. First and foremost, Heidi Moore, Director of Emerging Markets and Inclusion at Froedtert Health. She is also a recent Milwaukee Film Board member. So Heidi, excited to have you here. And Geraud Blanks, Director of Cultures and Communities at Milwaukee Film, who has been at Milwaukee Film at least 3 times longer than I have. He's going to take, he and Heidi are going to take you through what the Minority Health Film Festival is and why it's so important. So I'll let you all take it away.
Thank you, Sebastian. Everyone can hear me just fine, hopefully. All right. So I'm going to attempt to share my screen. Can everyone see this?
Yes.
Everyone can see? Okay, just making sure. I tried to do it yesterday and malfunctioned. So just want to make sure that I'm not off on my own presentation. Okay, so anyway, I'm just using these slides really as some visual background, but here's the gist. The Minority Health Film Festival started last year, 2019. It's a great origin story. I don't have time to take you through the whole thing, but I'll give you the short version. I was talking with one of my colleagues, Ronell Washington, a man about town and influencer, and I was really peeved about a particular festival and the support they were getting locally. And I said, you know what, I got an idea that I think is much better. And I started scribbling some stuff out. I sent it to Ronell. He was like, this could work. Let's go. So I put together a proposal. Now, mind you, I don't think anyone at Milwaukee Film knew I was doing this. But that's kind of, you know, do you ask for permission or, you know, what is it? Ask for, you know, apology, whatever. So anyway, I threw it out there. Well, I was about to throw it out there. And before I could, Maureen, another one of my colleagues, Maureen Post at Milwaukee Film, said, no, we have a protocol to this. Heidi Moore, I was like, who? She was like, Geraud. She sponsors Black Lens every year. Froedtert is a partner. We gotta do this the right way. I was like, okay, well, just give it back to me in a week because I got somebody ready to go. Ronell has somebody. So Heidi wouldn't let go of the proposal. For week after week after week, I was yelling at Maureen, where's my proposal? Needless to say, Heidi wouldn't let it go, came back and said, I want this for Froedtert. And she took it and we were off and running. And the original idea was to do it in April because April is Minority Health Month. But we didn't come up with the idea until February. So April wasn't gonna work. So we ended up moving it to September. And so last year, yeah, it was our first year. And the concept is very, very simple. We are all about, and Heidi actually brought this concept to me as social determinants of health. I didn't know much about it before her, but she really educated me about this idea of we have to look at all of the factors in our lives that affect our health. It's not just about, you know, diabetes and blood pressure, although those are very important. Look at all of the things that impact our health. And so she really helped me to look at it more holistically. Our inaugural event, like I said, was last year. We had about, I think it was about 8 films and as many panels. Took place over the course of 4 days. Our first kickoff event was Charlemagne the God of the Breakfast Club. Some of you may be fans of the Breakfast Club. He's a really controversial commentator and radio talk show host, but what's great about Charlemagne is he really pushes the concept of health and mental and emotional health in communities of colors. We had about 80 filmmakers and panelists and featured speakers from all around the country. Heidi booked nearly all of them. She did a great job of just giving us a diverse group of folks to talk about issues of health. Again, like I said, social determinants of health. We're looking at physical environment, health behaviors. We're looking at socioeconomic factors, and we'll talk about this more because socioeconomic factors, as you can imagine, are a big part of this year's festival. And then today's opening day, like we literally just got done, Heidi and I, about an hour ago with Dr. Kamara Jones. If you missed it, do not fret. We have it recorded. We're going to be pushing this thing out over the next few months. This was amazing. She's an amazing human being, but this presentation was far beyond what I had expected. And trust me, you'll want to tap into this and check this out. It was amazing. So then tonight we have a drive-in. We're doing a drive-in movie, and I know some of you are like, wait, you have a virtual festival and then you have a drive-in. Yes, throw everybody off. But last year we did a resource fair and we weren't able to do that this year. So Monique Graham of Freighted Health had the great idea of why don't we do a resource fair under the guise of a drive-in movie. So we're doing that tonight. We have 2 features. If you come out, we still have tickets available. We have a family feature at 5 and then an adult feature. And I sometimes, got to be careful when I say an adult feature. It's just a film that's not appropriate for small kids, but I thought it was hilarious. I think, Seb, you've seen it. It's Good Boys. So if you want to leave the kids at home, come on out to the 9 o'clock feature. But roll through the rest of this. This is really, I think, important. This year we came up with 3 festival tracks. This was really Heidi's idea. We have family health and wellness. We're just thinking about all the ways that we can engage our families, like literally our families and the other families within our neighborhoods and with our community around the things that they need: resources, education, information. And then I almost skipped it, community health and well-being. This, we're taking more of an approach of how can we work with other organizations within the community, other groups, to again address the needs of families, of individuals, because it's all about people. And then the last one is institutional health and well-being. I really love this idea of, at Milwaukee Film, we're trying to think about health and well-being from the standpoint of, one, is our staff healthy? Mentally, physically, emotionally, but then what's the health, what's the well-being of the organization? Are we doing the things we're supposed to be doing? Are we staying on mission? Are we addressing the issues and concerns that are an important part of what we do? And so this last little bit that I'll talk about, and then I'll hand it over to Heidi. Community representation is so important nowadays. It is, and representation is something that I find to be a little bit difficult for people to fully understand. It's not just enough to put a black or brown face on a screen. It's not enough to say queer folk are welcome. You have to actually hire people that represent those communities, that speak the language, know the culture, right? And then when people come to your place of business, ours is the Oriental Theater, right? How do we engage them? And how do we make sure they feel represented, they feel welcome, they feel a part of our community? Cultures and Communities is the department I represent. It started last year with just an idea of how can we bring together all of our culturally specific programs, Black Lens, Cine Sin Fronteras, and Genre Queer. And again, I'm constantly telling people, this is not about segregation. We're not trying to say, oh, we're over here. We have our own little enclave off to the side. No, this is about how do we make sure all of these groups feel included, groups that have historically felt excluded. How do they come to the table and how they are part of the conversation? So Heidi, I have talked enough. Yeah, let me get out of here.
All right.
Pass the baton.
Yeah, so I think as I think about Rotary and I think about the members, right, maybe it would be interesting for me to share the why Freighted and the Medical College of Wisconsin Health Network. Why is this important for us to partner with Milwaukee Film, with Geraud for the Minority Health Film Festival specifically? Why I would not let that project go. And so I think the healthcare piece makes a lot of sense to everyone. I think that's the obvious, right? We're a healthcare organization. As Geraud mentioned, from a social determinants of health standpoint, though, when you think about a person, each one of our individual health, there's only 20% that we can do in the clinics and with doctors and with nurses and with all the rest of the staff. There's only 20% that we can address. So that other 80% becomes very important. Now, I think this is also a good place for me to share a little bit about my background, because I've had the pleasure of really doing, I'm the director of emerging markets and inclusion. I'm on the diversity and inclusion team working on equity as well. And so I've been here at Freighter for 6 years. I'm a Milwaukeean. I've never had to move or leave, but for most of my career, more than 20 years, I've actually spent it working in Fortune 500 companies. And most of that time has been doing equity, diversity, and inclusion work and leading that work. And so in one Forbes 100 company as well. And so here's the reason why I share that. In order to address the whole person, as Geraud mentioned, it requires every industry, every sector. Freighter is, one of the largest employers here in the region. So we do think about this from an employment standpoint. But in addition to that, we also are very clear that we cannot address the health of the whole person by ourselves. We can impact that 20% directly, but it's going to take partnership with organizations like the ones that you represent, partnership with sectors like the ones that you represent. I saw education being represented as an example, in order to address the health of the individual, but fundamentally the health of our community. So that's why it becomes important to us. That's why we're so engaged. And I'll just pause there, because perhaps there are questions for Geraud or maybe for myself.
Feel free to unmute yourself if you want to ask any questions.
And if not, I can share an example of what we're doing here at Freighter, if that would be helpful.
Can you talk a little bit more, Heidi, about that 80%?
Yeah, absolutely. So that 80% represents the neighborhoods in which we all live in. It represents access to food, or healthy food more specifically. It represents the roles or jobs that we have if we are employed. It represents if we're not employed, that's a part of it as well. Earlier today, in kicking off with Dr. Jones, I sort of used myself as an example, right? So I'm a mom, I'm a consumer, I'm a policy owner for one of the life insurance companies here. I'm, a taxpayer, I'm a homeowner. All of those things have an impact, that 80%. And so, anyway, so that's why healthcare cannot address it all directly.
And with
Is there? Go ahead. Well, I was just going to share. So let me share an example of what this might look like for your organization, because I anticipate that after this presentation, everyone will be calling Sebastian and Geraud, because you'll want to participate next year, right? So let me give you an example. Just recently, just a couple of weeks ago, actually, our president and CEO, Kathy Jacobson, just launched publicly our Eradicating Racism and Enhancing Healthcare plan. And so a part of that plan is education. And so what I love, one of the reasons why I love partnering with Milwaukee Film in the Minority Health Film Festival is, man, I have my whole education curriculum built out just in the Minority Health Film Festival. Because everything that's covered in the Minority Health Film Festival, all of those topics impact our organizations, whether we realize it or not. If we have staff, if we have employees, then there's a topic that's covered in the Minority Health Film Festival that you may want to learn about as a leader, because it might help you to become a better leader. You may want to learn about it for your organization, because it absolutely will help your organization become a better organization. And so that's the approach that we're using here at Freighter as well. And so I'll just quickly wrap this part up and see if there are any other questions. With Dr. Jones talking about racism, so the topic was dismantling racism. You wrote a statement, or you made a statement, now what do you do, kind of thing. And so that's true for us. Our president and CEO put out some statements. We have this plan, absolutely, but it's important. I can't do all of the work that's required here at Freighter as an employer to address racism, to identify racism. I need partners. And so my key stakeholders today, I'm very proud of them, join. These are VPs, these are executive VPs, these are presidents. Join today for Dr. Jones. And they also ask their leaders to join. And they also ask some of them, their staff to join, because we're all utilizing the Minority Health Film Festival as an opportunity to learn and to get better. So I'll just pause there.
Looks like we have a question in the chat.
Yeah. So it says, can you give us ideas and how businesses and nonprofits can better engage in 2021? I assume this is for the festival itself.
So I'm absolutely sure Heidi has something really good for this. I'll just say from the standpoint of Milwaukee Film, in thinking in terms of the Minority Health Film Festival, I'm going to be really frank, really candid with you right now. A lot of people are putting out statements. I would suggest, while statements are fine and good, I think 2021 needs to be a lot less statements and a lot more action and a lot more engagement. So, for one, this year's Minority Health Film Festival, and Seb and Heidi can speak to this, we've had more corporate engagement than we could have ever imagined. We actually thought it was going to be much more difficult because of the time, financially and just in terms of everything going on. And I would say that our corporate engagement we were all shocked. Let me say that. In terms of the fiscal contributions, in terms of the ways in which, we've had several corporations. I'm actually doing this sort of presentation, or I'm doing talkbacks with the staff at several of our partner corporations. So what they've done is they said, hey, we want to support the Minority Health Film Festival, but we also want to get something back. And it's not just putting our logo on your promotional material. If we direct our staff to watch certain films, can we then somehow engage them in a meaningful dialogue afterwards? And I was like, of course, that's what we do. I said, how much money do you have? Because I'm not cheap. but it was like, well, actually I am. I'll go talk to anybody. I love to do this work. And so what happened is a lot of I spoke a little too soon because everyone took us up on that. And I have about 5 or 6 scheduled over the course of the next week where I'm just talking to the staff of an organization or corporation that has engaged in a film or two. And we're having a real talk about race, about culture, about health, and what does all that mean? And what we're hoping for is that, one, people will be very open about what they're dealing with in their workplace environment, right? But then also will feel like they have an opportunity to not only to be heard and also to be informed about what other staff, what their colleagues are dealing with. So it's a really exciting time. And I think 2021 needs to be more about that, more about finding, there are other Minority Health Film Festival type events. I feel like companies need to engage and get their staff engaged in dialogues that are meaningful beyond the great statements that we put out and beyond just the sort of standard diversity and equity training. I really think staff needs to be engaged in dialogue and discussion. That's my thoughts.
I see questions here about give us some actionable, right? Some action, like what can we do? What are some specifics? And so maybe I can take that on. And so even one says, give us something actionable when we get to the office on Monday. Let me give you something actionable now in preparation for Monday. You're here and you're learning more about the Minority Health Film Festival. Go to mkefilm.org/MHFF and take a look at the content that's available through film, through community conversations, through that. Take a look. It's a lot out there. Geraud went crazy getting films. He's got over 50, but all for a good reason, right? It means you have opportunity. You can choose a short film, you can choose a longer film, but identify a topic that you want to bring back to your office with one, two, or maybe all your staff on Monday. So do that homework, identify a topic, and then commit to, if nothing else, watching that film and getting as many people as possible to watch that film. But then you already heard Geraud, he's still taking requests to do talkbacks with your staff. And I'll even offer up myself. So it's interesting, because I doing this for 20 years, I've facilitated lots of education around equity, diversity, and inclusion. And I'm a big fan of immersion experiences. I've seen faster development and growth through immersion experiences. And so here's what that looked like in the past. In the past, can't do this right now, but in the past, executives would say, I don't know where to find Latino engineers. I don't know where to find MBAs. I don't know where to find diverse accounting folks. So CPAs. So I would get them on a plane. We would go to partner organizations, Black engineers, Hispanic engineers, women engineers, Black accountants, Hispanic accountants, all of those organizations. But when you get there, you have 14,000 African-American or Hispanic CPAs or engineers or whatever, and it became an immersion experience. Most of these leaders had never been in a room with one or two Black CPAs, let alone 14,000. So that learning curve, because now we're getting into all kinds of dialogue, now there's the possibilities. Now you can see, yes, you can diversify your staff. So here's why I share that with you. One of the reasons why I love Minority Health Film Festival is film has now become that immersion experience. And I think what's great is that some of us can watch the film in our own private, living room. Some of us can watch the film together, but it becomes one way to have an immersion experience to learn about topics and life experiences that perhaps you just are clueless to because it hasn't been a part of your life experience. And from there, you can start to have dialogue with your staff and learn more, and then start to take a look at the strategies of your business and perhaps shift some of those. So hopefully that was helpful. Not sure where we are with time or questions, but.
Feel free to unmute yourself if you want to ask a question in person.
So where is the drive-in theater tonight?
You familiar with the Pfizer Forum?
I am.
Right next door in the lot where the Bradley Center used to be. So I was just out there this morning. We got 2 nice sized screens. It's actually kind of cool. It's gonna look really cool. So we have 2 screens. There's gonna be 2 sections of cars, and yeah,
Okay.
it's right next door to the Pfizer.
Good to know. I have to just put in a plug too for on September 22nd, we have a program at Rotary on the moral determinants of health. We have a professor from Harvard who I heard speak a couple of months ago. And I think it takes it one step further than the social determinants of health. It's very similar, but it kind of puts a different call to action almost, like, it's not just, these aren't just social issues, they're moral issues. And so how do we really take them on in a meaningful way? But it's a challenge.
It is. Are there other questions? Or thoughts or ideas?
This is a little more lighthearted questions, but Geraud and Heidi, do either of you have a favorite must-see movie in this collection that's coming up in the Minority Health series?
You know what that question's like, right?
Yeah,
I got
it's
3.
dangerous.
Yeah, I got 3 kids. And I absolutely love all my kids equally. No favorites. I know for me, so Sisters Rising, we have an amazing panel tomorrow. And I keep pushing people to Sisters Rising just because The film is only an hour long. It is unbelievably, it's just going to grip you. And we were lucky enough to secure both of the directors. There's two directors on the film. Both of the directors, the producer, and one of the subjects that the film is about, as well as Representative Gwen Moore. And the reason why Gwen Moore is a part of the panel is because she's actually in the film. And they absolutely love her. So they contacted me when we booked the film and was like, hey, we were supposed to do this event at Sojourner Family Peace Center in like February or March. It didn't happen. Can we do it with you? I was like, thank you. Absolutely. Yeah, we'll take that. And so Gwen Moore's office jumped right in and they were all over it. And so it was supposed to happen at noon tomorrow. It is moving to 1:30 because Representative Moore has, I guess, some important committee meeting with other Congress people that takes precedent. But we worked it out. We moved it back an hour and a half. But come to that event if you can. It's going to be amazing. But watch Sisters Rising. That is a great film. I don't know, Heidi or Seb, if there's anything else that jumps out at you. I keep pushing Decade of Fire.
Mm-hmm.
I think it'll blow people away. Decade of Fire, Cooked.
And the film that Rotary is kindly sponsoring, Charm City, which it should
Mhm.
probably get a little bit of a preview as well, if you don't mind doing that, Geraud.
So Charm City, I wish I could just throw the trailer in here. Charm City is an interesting film. We have a talk back around that that you don't want to miss, right? So Charm City is about Baltimore, but I swear to you, if I didn't tell you it was about Baltimore, you would think it is about Milwaukee. It takes it from several different points of view. It takes it from the point of view of police, Black police in Baltimore. It takes it from the point of view of a young Black city council person. It takes it from the point of view of activists. And what I love is the role of the elder in the neighborhood, the role of the advocate, right? The elder mentor. You rarely see that point of view in a film. You get that point of view. It takes it from the point of view of a violence interrupter, all of these different points of view, and you get to see a city that's struggling with violence, struggling with issues of police reform, and how all of these different groups deal with this. And it was an amazing look into the heart of a city that's it looks almost identical to Milwaukee. And so check that film out. You're going to love it. And then come to the talk on Wednesday at 7:00, Wednesday the 16th. We put together an amazing panel. It's going to be moderated by Judge Carl Ashley. We have the acting chief of police. I think it's Michael Brunson will be a part of the panel, with the director of the Office of Violence Prevention, Reggie Moore. And then Andre Lee Ellis, who's a community leader. And one of the reasons we wanted to get Andre is he reminded many of the people on the panel who had seen the film of one of those elders in the community. If you don't know Andre Lee Ellis, he does a ton of community work. So this is one of the panels I think I'm most proud of, and it's connected to your film, Charm City.
Gerard, I'll jump in real quick, and then there is a question, Gerard, regarding getting engaged without money, besides money. So Hungry to Learn is a film that to me is important. It's an important film. So Jenny, so nice to see you. So it's important to me, and it really and it may be because right now I have a college grad. I have 4 kids, so I have a college grad. And she's a filmmaker, so everything that comes. She obviously, you haven't seen any of her films, you haven't heard of her, so she's still struggling. So, but in any case, but then I have 2 now that are in college as well, and then one that's in high school. And so, Hungry to Learn to me is about Gerard. Let me know if I messed this up, but it really is about the journey of a few different students. And what's interesting is that they're homeless. And so it's, I used to, before seeing this film, joke about, yeah, I was a starving college student, but nothing compared to what these students go through. And the resilience of these students are just quite amazing. And how prevalent homelessness is for college students, and it's something I didn't know. So I just think it's an eye-opening film. And so for that reason, that's made it to my favorite list.
And to Heidi's point, we often think of all of the joys of college, right? All of these movies have been made and college looks like one big party. And we forget about the students that are working 2 jobs and aren't eating. And Hungry to Learn gives you these stories about students literally that are unable to afford a meal plan and eat throughout the day. And so, yeah, I agree, Heidi, that's a great one.
I ask a kind of a process question, which I should know the answer to, but do we go and download the films whenever we want to watch them, or is there a schedule? How is this virtual festival working?
So one of the great things about this is the films are available. Seb, it starts at, is it 4 today that they become available?
That's correct.
So at 4 today, all the films are active. You get them for 2 weeks. So what happens is you go to our site, you find the film, you click on it, you can purchase it. You get it for 48 hours. You can watch it right on your computer, or you can, if you download our app is available on Roku, Apple TV, if you have the Amazon Fire Stick, or if you have an Android TV. Like I downloaded the app and I can select films on my TV and watch them.
So you download the Minority Health Film Festival or the Milwaukee Film Festival? Okay.
Milwaukee Film app. So we have a Milwaukee Film app that you can download. But yeah, once you've gotten started, it's very easy to select films and watch them. And like I said, they're going to be available for the whole festival. There's no set time that a film is available. That's one of the advantages.
And then the panels are available through the app too, or?
So here's the thing, the panels, if you are on Facebook, they will be available on the Milwaukee Film Facebook page. We going through Facebook Live, they'll stream live. A lot of folks aren't on Facebook. YouTube, it'll stream live on our YouTube channel. It'll stream live on our Twitter page. And if you go to the platform, if you go to Charm City, there should be a button for that panel as well. So there's like 4 or 5 different places you can watch the panels.
Okay. That's very helpful. Thank you.
You can find all that information at mkefilm.org/MHFF, Minority Health Film Festival.
Yep, I pulled it up, but I just,
A lot of new technology for us this year, and a ton of different ways to consume content, like Geraud said, from your phone to your laptop to your television, which is a really amazing thing. It also allowed us to make the ticket prices extraordinarily affordable, anywhere from $1 to $3 if you're a member or a non-member, $20 to $25 for 20 for members, 25 for non-members. That's for an all-access pass. You can watch 20 films for $25. I mean, that's it. We're, as Geraud likes to say, we're giving this away. So there are all these questions about what should I be doing? Well, watch the content, share the information, share the website. We want people having this discussion. We want people consuming this content and having a dialogue, real communication, real discussions within their organizations and within their families and friends. This is a critically important time for these kinds of conversations to be happening, not just with the racial unrest happening in the country, but also with the outsized impact that COVID is having on communities of color. I mean, this could not be more important dialogue to be having right now. So really appreciate everybody tuning in for this conversation.
So Jeff, I was at that screening. I think it was a lot next to Harley Davidson. It was Aquila and the Bee, I believe the name of the film is. And yeah, so we were actually gonna try to partner with Parking Lot Theater for our drive-in, but the way the Bucks work is they handle everything. So there wasn't room for another vendor. However, we are hoping to continue to work with them down the road if we do more drive-ins. because they're really good at it. They handle all the aspects of it. So yeah, that's definitely something we would love to do. So if that's something you want to get involved in, just reach out to me. And then to Bill's question, besides money, how can Rotary partner with you to eradicate racist health disparities? Wow.
Just a little question.
Yeah. Well, I'll say this from the Milwaukee film standpoint, and then Heidi could address this further. But I just, money's great. You know, you need money. It's one of those important resources. But really, for us, we just need folks helping to, one, put the word out, let people know. That's really important. Also, actually taking part in going and watching a film and taking part in a discussion. And then these opportunities right here are really, really important for us to reach more people and to talk to more folks. But to be honest, my work, Heidi's work is to eradicate racism. That's not my work. I can't do it. My work, my job is simply to give folks like Heidi a platform. My job is to, I'm going to get you in with the movies. I'm going to get you in with this great conversation. And then Heidi's the one that's going to come in and solve all the problems. My job is to create the platform and, frankly, to find ways to engage the community so that we can together work on issues of racism. But I would say, Bill, the best way to partner is just to get involved. And we could use all the help you are willing to give us in terms of helping us to reach more people with this message. But Heidi, tell them how we can eradicate racism.
Well, so one, just wave a wand, right? No, it's a lot of work to be done, and therefore all of us are required and all of us are needed. And I mean, just having this conversation, and Mary shared what the next conversation will, that topic as well. I mean, all of those are action steps towards eradicating racism. Jenny's on, and so for the YWCA, this also is the work that they do as well. But if this is Bill, I'm not sure, I can't see Bill, but if it's Bill Coleman, who also is CPA, accounting, I don't know if that's the Bill Coleman. If it is, then I'm familiar. I'm familiar with your work, and you may not remember me, but when I was at Northwestern Mutual, I remember you working with a lot of students. And so that's one of the things specifically for you that came to mind. Besides the work that you do in accounting, the students, this content, if we can engage as many young people as possible with this content, with this experience through film and then these community conversations, because fundamentally, they are our leaders. They are our future. And so everything we're doing right now is contingent upon how well we take care of and support the young people today. Not saying we're not young, because we know we all got lots of years, God willing, left, right? But fundamentally, we've got to bring that next generation, not just along with us, but help them to take the lead. And so many ways, I'm so open to having conversations specifically about each and every organization on what specifically you can do based upon your products and services, based upon your strategies. I'm so willing to have that conversation. But if it is that Bill Coleman, then that's one of the things I thought about as well.
Well, I'm just going to say thank you to everybody here on the call right now. Typically, we wrap up at around 12:30, but always encourage people, if the speakers are willing to stay on a little bit longer, to continue the conversation. But so I think if you all are willing to keep talking, people will probably keep their Zoom on. So, but officially, we will consider this complete, and thank you. I mean, it was really very, very informative. I'm so glad I had the chance to participate and listen and learn.
Mary, this is Darren. Bill didn't jump in, but that is the one and the same Bill Coleman you're speaking of. He's too humble.
and he's still working hard on behalf of Milwaukee kids.
Great.
Always, always, always.
Great.
And can I say to that? So that's interesting because I'm working with the YMCA right now on a program we're doing. Actually, we just got done doing a program through Black Lens where we had teachers and educators come in and watch a film, a short film, right? 10, 15 minutes. And then immediately afterwards, we would have a talk back. And the idea was teachers wanted to learn first, how could they incorporate film into their curriculum, right, as a pedagogical tool. But then second, they also wanted to learn, you know, they wanted to experience it firsthand, right? What does it mean to watch this film and then have this really heavy dialogue? And it was an amazing experience talking with these educators and having this really candid conversation about really, really tough issues. But we used film as a way to introduce the conversation. And so now I'm working with the YMCA. They have a program for young boys and men of color for 4 weeks. We're going to start with, I got a set group of films. They're going to watch the films. We have a dialogue. Then that's one day. Then the next day, they have another dialogue with someone else that builds on that. And so they have 4 of these sessions a week over 4 weeks. And I'm just really excited about the opportunities to educate youth, students using film. I just think it's really, really powerful. And so just when we were having that discussion about working with kids, that just came to mind.
Heidi, Gerard, this is Darren Miller again. I shouldn't be surprised that Ronell's involved. I mean, he's a catalyzing figure and he's involved in so much. It's good to hear.
Ronell and I joke about this, right? Because I gotta, you know, can't use specific names, right? But he was the one that came to me. I was upset because I felt like, you know, I had some ideas and I wasn't sure how we could get support for them. And Ronell was like, well, Geraud, I know if you take it to so-and-so, they'll eat this up. And I said, okay, Ronell, you know, here you go, right? And it was so funny because I remember Ronell hitting me back like, gee, what's up? Come on. They're waiting on it. They're waiting on it. This idea is ready to go. We can make this happen. And Heidi was not having it. Heidi said, nope, that is not, nope, you are not letting this go. This is ours. And it was funny because when I told Ronell, at first I think he was disappointed, but then he was like, hey, whatever, let's go. whoever wants to jump on it, I'm with it. And Darren, I'm sure you know, if you know Ronell, he is a go-getter and he gets out there and he's a charming guy that knows the right people to talk to and how to connect folks. And he has just been huge for us going out in the community. And really this started with him saying, all right, put something together and I'll go get it to somebody. That's how all of this started. That somebody just happened to be, unbeknownst to Ronell, happened to be Heidi. She jumped in and intercepted it.
But you know, if I could just maybe just 30 seconds add to that. So everything we're talking about has this human element, right? It's deeply, the foundation of it has to do with the human element. But the fact of the matter of it is that it was going to go to a competitor. And I know, you know, some people, it might make you cringe to know that in healthcare, we do look at others as competitors. It was going to go to a different healthcare system. And so it was definitely the human element. It was everything from an equity, diversity, and inclusion standpoint, but it also was a business decision. And so we were smart enough, if I may pat Fredert on the back, to know to partner with Milwaukee Film early on because they were doing some great work. And so when new ideas come from a great partner, it's great that, you know, hey, we were here, so why don't you let us look at that new product or service first, and let us decide if this is something that aligns with our strategies, as it did. So
wait till you see what we're putting together for next year, right?
Right, absolutely. So thank you guys for this. This is a great opportunity to share a little bit of our story. last year, Gerard and I did the media circuit together, so we were able to joke around. And so this gives us a different way in which to do that. So thank you.
So with that, I think we'll close out the program.
Thanks, everybody.
Thank you again.
Thank you.
Thank you.
Thank you.